So, Claire, Aminthia, thank you so much for coming back on the podcast. And I am so excited to dive into what's happened since I last have had you on. It has been a while.
Yeah. Oh my gosh. Yeah, it's been since like January. And yeah, like you said, and like we were discussing, we both had a shift in our niche. We just hype kind of hyper focus more on disability, especially invisible disabilities and people who are immunocompromised. And we have shifted more into also accessibility with our advocacy, what we do with Sista Creatives Rising. And yeah, you want to kind of go into that more?
Yeah, because as we went along, we realized we realized as things were shifting, as the COVID protections, the time for the COVID protections got closer, we realized that we were getting anxious, and we were seeing anxiety with the people we communicated with as well. And then when it happened on May 11th, it was like, it was a shock. It ran through, it was like a shock. You could see it in online and everything. And people were immediately like, oh my goodness. Because immediately we got a text that night, or it was an alert that no masks were required at hospitals anymore. It was immediately, I remember it came through.
Mm-hmm. I
and
remember.
we were like, oh my goodness. Because before then, I didn't really, as a person who's in recovering from cancer and have to go for 2-month checks, I didn't think about everyone around me within the last year as I went through my cancer situation were wearing masks all the time. Mm-hmm. So I didn't have that extra stress. I had other stresses in my life, but I knew when I went to my doctor appointment, I felt like I didn't have to worry. Mm-hmm. And immediately, as soon as that happened, I immediately felt the stress hit. And it felt like it was one more thing that was layered upon everything else that I have to deal with in my life right now. And for me, going to the doctor or going to the hospital, I always felt safe and cared for because everyone around me masked. And I was like, began hearing stories of people who were going to the doctor and getting into arguments with their doctors, with nurses who were taking care of them,
with oncologists,
endocrinologists. Endocrinologists were arguing about why they shouldn't wear masks. It's like, oh my goodness, I have so many appointments to do in the coming year. And it's just been very stressful. And I feel it every day. I worry about the next appointment, who I'm going to run into, that who I'm going to have to convince that it's important to wear a mask, not just the surgical mask now, because I'm immunocompromised. I have underlying
pulmonary disease. You have like 3
comorbidities. And I am dealing with the cancer situation still. So every time you go in there, you might meet a nurse that have a different view on it. And I try to set up everything. I send letters. I call before I go into my appointment. Please I need you to wear N95, not just a surgical. The reason why I ask for N95 because it's better fit. It fits better. And I feel more comfortable when I go into the appointment. I don't feel as stressed because I have complex PTSD, panic disorder, and agoraphobia. So it helps me not to have anxiety when I go to the doctor. And so I ask for them to wear that mask that fits better, because in the room, not the people that I meet, not the secretaries or whatever outside, when I'm in a closed room with the person who is going to be interacting with me, wear N95. And there's a fight. And so we are seeing this with other people as well. So it's just really very stressful time.
Yeah, and we were talking about this before we even started this episode, is that I was a certified nursing assistant for 15 years in my healthcare career. And it's the same kind of thing. When I was a CNA, practiced as a CNA, there'd be times where we'd have patients that were in isolation. And so for safety, we'd either, depending on the level of their illness, we would, wear masks, obviously gloves are a no-brainer across the board, whether they're sick, they're really sick in isolation or not. But, masks, gowns, booties, hats, whatever it might need to be for safety. But the same thing is true for us as the workers. If we were starting to feel sick or or something like that, we would, have the wherewithal to put a mask on and just wash our hands and just be careful, so we wouldn't get our patients sick. And so I think the same kind of rules apply here from the healthcare industry and the clinics, that it doesn't have to be for everybody. I mean, obviously we want to be people safe, but if you specifically know that your next patient has, looking at their chart and their notes to see, because they eyeball their chart before they walk into talk with you to refresh their memory on where you're at. If you know they're immunocompromised, please wear a mask. It cannot help. It's the same thing as when I was an aide, like, we would practice, like if you're going in to work with someone that's even more susceptible, that, not just washing your hands and wearing gloves is enough, wear a mask, to protect, as a courtesy, to keep both, more importantly, the patient safe, but also you safe, because you don't know. So, and I can understand how it could feel like, I can see both ends of the spectrum. I didn't, like up until from January through May of 2020, I was, wearing a mask all the time at work for my whole shift when I was still practicing as an aide. And that was just the tip of the iceberg point. We weren't hardcore into it as much as like by the end of 2020 into 2021, we were, for being shut down and everything. And so I understand that from a healthcare worker perspective, just always having to wear a mask. You can't breathe. For those of us who wear glasses, it fogs up our glasses. We can't see a thing. And so I understand the uncomfortableness of it, but more importantly, as a healthcare worker, or former healthcare worker for me now, it's still important that we serve our clients and our customers to the best of our ability by keeping them safe. And if that means for that 15 to 30-minute interaction that we're with them, that we wear a mask to keep them safe, we should be doing that. If nothing else, like what Claire was touching on, or the mental and emotional peace of mind for that patient, because like Claire said, she has panic and anxiety and stress. And so what can we do to keep them safe in terms of even just doing that, just out of common courtesy and respect? Okay, we're not saying that that doctors and nurses have to do this with everybody, or we're trying to push that on everybody, but at least for the ones that we know they're at a higher risk for even just interacting with the public, and they're doing what they can to be homebound. But for medical appointments, it's obviously very necessary that they go in to see their medical professionals. Can we have the medical professionals just really take that into account? Because it is serious. It could be a life and death thing if their immune system crashes. That's what we're getting at here. It's not to say that the medical system is all bad and that they're out to get us. It's just maybe just instilling a little bit more of advocacy for the patients from their end in that sense, even though COVID is dying down in some ways, but it's still there. It's not going away. And there's still a lot that we don't know about it, that we're still trying for them to understand how it works, because it is mutating and there's no perfect vaccine yet. We still need to be advocating for the safety of everybody across the board. Okay, post-COVID or pre-COVID or wherever, or during COVID, whatever the situation is.